Hi, Dr. Nicole here. So this is another series in our Voyage to Vitality. So today we are going to talk about the main causes of a root canal. So I'm going to break out my whiteboard with my really cute Bob Ross tooth, and we are going to talk about the causes of root canals. Okay, so let's talk about the normal need and cause of a root canal. Root canals can be caused by a variety of different things, but we are going to talk about the most common reasons. There are extenuating circumstances and things that need to happen, but these are the normal reasons. Okay, so before we talk about those, let's recap the different areas of the tooth and what's going on with the root canal. First, there's the white part of the tooth, the enamel that you see. The second is that there's the center of the tooth called the dentin. That's the yellow stuff that you see if you break a tooth or get some recession. And lastly is the center or the nerve of the tooth, aka the pulp. For those of you that search on Google MD, that is what we're talking about, okay? So what a root canal is, just to recap, is you go in and there's some type of infection that causes the nerve of the tooth to die. The dentist goes in and cleans out the center of the tooth and all of the infection there, and then leaves your body to heal the infection at the end of the tooth, okay? So what are some of the causes of it? So some of the most common causes of it are, number one, a cavity, okay? What do I mean by a cavity? You have a cavity that is big and extends from the outside into the center of the tooth or very, very close to the nerve of the tooth. This traumatizes the nerve and causes the nerve to die with time, okay? Another one is your bite. So what do I mean by this? People who clench and they grind and they place a lot of pressure on their teeth, that can cause the nerve of the tooth to die. When you are putting pressure on your teeth over a long period of time, it can cause and will cause death of the nerve. Okay, so that's a second cause. A third cause is having a deep filling. All right? A deep filling, if you have a deep cavity and you have a filling that's put in that's very, very close to the nerve of the tooth, that it can also cause the nerve of the tooth to die, similar to that of the cavity. All right? Another one is a crack in the tooth. All right, this is similar and caused by something like having a heavy bite on the tooth, and a crack can also be caused by having a filling that's been there for a long period of time, that's large in size, and it can create cracks that happen and crack the tooth to need to have a root canal because the nerve dies. And last but not least, for the normal reasons to need a root canal, is trauma. What do I mean by that? Actually traumatizing a tooth, golf club to the face, car accident, all of these wonderful things. I don't know how my teeth made it through my childhood with all of my bike accidents, but they did. But a lot of people will traumatize their teeth and need root canals in the future. So let's recap. The 5 most common reasons for needing a root canal is a cavity, is having excessive bite forces on the tooth, is having a deep filling that gets close to the nerve of the tooth, having a crack in the tooth, and last but not least is trauma. So if you have any questions or want to discuss the causes of a root canal further, please feel free to give us a call, but until then, keep on brushing.